you had. So the evaluation for the new Osce takes a different direction, and it's exactly different as compared to the old Osce. So for the new Osce, you are provided with a form of sheet like this, which has an S-bar elements. And S-bar, we have situation, background, assessment, recommendation, okay, and that's what will guide onto what you will do. Initially, evaluation in the old Osce was a silent station, which you would just write. Unlike the new Osce, the evaluation is an oral station, whereby you are supposed to give a report either for handing over in form of a referral, or you are passing some information at the end of shift. So you are going to use S-bar as a technique to hand over the patient's information, and you have to be keen, and you must have information on your patient prior to giving that information. I would advise that you just jot a few issues about the situation, background, assessment, and recommendation, so that you will be giving your information correctly. Now, for the situation, here you are just identifying yourself, identifying the patient, and identifying the situation. So for this case, I'll state that my name is Vincent Obita, a staff nurse, okay? And I'm going to give you a report of David Jones, okay? Date of birth this, NHS number this one, and this is a end of shift report concerning this patient, if maybe it is a transition during end of shift. If it is a referral maybe to nursing home, then you would say this is a report to the nursing home team and things of that kind. With that one, you are done with the situation, okay? Then now you go to the background. As it states, background covers the information this patient had prior to what's going on, okay? And here you will just give the history of the patient, and this one is obtained in the patient scenario you are given during assessment, and also you will have it during your evaluation. So you will state David was admitted with anxiety. David was admitted with low mood and self-care deficit for 6 months, maybe after losing his daughter or wife and things of that kind, okay? So you will talk of the reason for admission, and that's usually provided in the scenario. That's the same time you will also talk about the presenting illness. He came maybe presenting in a certain manner, maybe breathlessness, any condition that he came with during admission, it will be stated at that hour, okay? The past medical history, David maybe is hypertensive on this medication. He had heart attack 10 years ago and is on follow-up and things of that kind. You will also talk about allergies and their reaction. David is allergic to peanuts, which causes rashes, okay? He's also allergic to penicillins, okay, which causes anaphylaxis. So those ought to be taken into account. Remember, the report is to ensure that the next team is able to take care of this patient accordingly. Now, after giving the background information, majorly the past medical and social history, then now you move to the assessment. And the assessment is what you've observed during their stay in the hospital, the nursing care needs that you've identified, and what you've done. So you will state that During my assessment, David had a blood pressure of 140/80. The respiratory rate was 20. You will also talk of the temperature and the heart rate at that moment. Okay. During the stay, patient displayed low mood. Okay, of which we engaged the family. We invited the mental health team. We invited the mental health team, and we've also assisted David to catch up with the activities of daily living. We also determined that due to the grieving, David had lost appetite. Okay, so with that one, we've been trying to provide David with meals that he opts to have. Okay, it's kind of, we are lifting a portion of the nursing care needs in the plan. Okay, so that you present it in your evaluation. So your areas of concern will also be captured at this moment. Okay, maybe something you can state that despite all our interventions, David still needs help in terms of coping with the activities of daily living. Remember, that's the report you are giving. Another concern you are having, maybe if the blood pressure was high, you would like that the blood pressure be assessed at being monitored closely because it's of concern to you. With that one, you've provided your assessment information. Okay, and again, that captures the care you provided during the patient stay. And remember, you are giving it orally. Okay, then now you move to the recommendation. The recommendation is what ought to be done by the team that is taking over the care that you provided. Now, under the recommendation, you can state that I recommend the mental health team to review David every week. Okay, so that the care can be continuous. Then again, you can also, maybe the patient is allergic to a certain medication and it was prescribed. So you can state that since David is allergic to penicillins, I would recommend that his medications to be reviewed and alternative antibiotics be provided to David. With that one, you are done with the evaluation portion, and you will be good to go. When you are done, you just tell assessor that with that one you are okay to go. And remember, it's oral, so when you are done, you are home and dry. Thank you so much. So that covers basically the new Osce evaluation, which is oral, unlike the previous one, which used to be written. So I think we can respond to some of the questions that you've raised. I'll commence with what you provided, and maybe Zana or Saleh will come along to maybe answer some of the questions. I can see someone is stating that we should have recorded the session. We will consider that one. Someone is also talking about doing another assessment. We can arrange for that assessment portion. Can we get a copy of the notes, please? I'll talk to Saleh, who will maybe send the notes in the Telegram group. Assessment of the new Osce